and stability as you're kind of moving, because our neck allows us to go up and down, side to side, rotate back and forth, and move all in different directions. So we need to have fibers supporting each of those directions. So part of it is, or at least when we start having a herniated disc where it starts bulging out, some of those fibers have gotten disrupted, torn. We start to have dehydration of the disc as we get older. After the age of 35, things start to dehydrate a little bit in the discs. We start to lose height. The ligaments that support on either side of those discs don't necessarily change in length, so basically it can get a little bit loose in there, which requires us to have a little bit more muscular stability in there, resulting in some of that kind of disc material wanting to squeeze out a bit. So the tearing in the fibers, they don't necessarily have to be from like trauma. They don't have to be necessarily from being from just like wear and tear. It could be just regular aging process. So basically, some of that disc material will come out. And does it have to cause pain? Not necessarily. If you just have isolated pain in your neck with a herniated disc, sometimes that's just the disc fibers because there is nerve innervation. So like this yellow line here is just nerve being innervated to the outer fibers. So that can be very painful for somebody. But generally that pain goes away in 8 weeks. It just depends whether you're able to tolerate that pain for 8 weeks or not. That's one thing that they don't tell you. And the other thing is the radiation of the pain down the arm, if that's what we're talking about or that's what you're experiencing. And that pain will come through as long as there's compression through that disc and there's compression on that nerve as it exits through the hole in the neck. So talking about the neck itself, so that's our herniated disc up there where that disc material is squeezing out. So we have the little spaces that we were talking about before. So each of these little spaces here is a foramen or a hole where we have the nerves come out of with these little spaces. So like if you stack one on top of the other, they'll create that little hole. And basically if the disc is sitting out here, it'll squeeze out and kind of compress that hole a little bit, giving you that compression and that give you that radiation of that pain down the arm. So we have that normal disc, we have a bulging disc, and then we have the herniated disc. And there's different levels for that too. It's not important necessarily for you to know and understand. Just know that there can be some compression through that. They are showing that in research now that not only don't necessarily have to have pain from a herniated disc. So if you have an image done, so MRI is usually the one you're going to see it from. They say that some people or some doctors say that they can see a herniated disc on an x-ray, but that's not necessarily true in the sense that it's only going to show you bones. It'll show you if you have a decrease in disc height, that's fine. They may associate it because you have some numbness and tingling down the arm. Okay, maybe, but is it telling you that's what it is? Not necessarily. If you get an MRI and it shows you have a herniated disc, is it what's really going on? Maybe. It just depends on what else you present with and how it kind of flows along with your story. Because they're showing that even with rotator cuff tears in the shoulder, they did imaging of different people, different ages, sports backgrounds, non-sports backgrounds, and they found that people who, at least in the elderly population, this is the painful one. They have a little bit of a tear, but the other side is completely torn and they have no pain. So pain and what appears on an image doesn't necessarily correlate. So if you do have imaging ever done, don't necessarily associate. Just say like, okay, this is part of the story. Bring it back to whoever you're working with to figure out like what's the real main cause of it. So basically, if you have nerve root compression, you can have difficulty lifting, carrying things because we have the disruption. It can disrupt not only the sensory kind of function, so your ability to touch, to feel, numbness, the tingling kind of stuff, but can affect how muscles actually work, depending on what part of the